Polycystic ovarian disease, a new gynecologic epidemic. Let's understand and treat it. Hello, I am Dr. Kirti Nahar, Senior Consultant Gynecologist at Apollo Hospitals, Ahmedabad. Today I will be talking about much debated topic, polycystic ovarian disease. It is one of the commonest metabolic and endocrine disorder affecting women of reproductive age group. It can occur at any age after menarche up to menopause. Its incidence is on a rise. Almost 1 in every 10 women now suffer from polycystic ovarian disease. Every year, 12 million new cases are being reported. It's a new gynecologic epidemic. 50% of patients of PCOS go undiagnosed. 50% of patients of PCOD develop pre-diabetes and full-blown type 2 diabetes till they reach 40 years. And PCOS women, we see that there is 2 to 6-fold increased risk of developing endometrial cancer. It is an alarming statistics and we need to understand and treat it. 50% of patients of PCOD go undiagnosed and 50% of patients of PCOD develop pre-diabetes or full-blown type 2 diabetes till they reach the age of 40 years. In PCOS, there is 2 to 6-fold increased risk of developing endometrial cancer. It is an alarming statistics and we need to understand and treat the disease well. What causes polycystic ovarian disease? There are multiple causes. It may be genetic. If your mother or sister has PCOD, there is high likelihood that you can also have PCOD. Then wrong dietary habits, sedentary lifestyle, excessive weight gain, obesity, stress, increasing pollution all play an important role in causing PCOD. An important pathophysiology in PCOD is insulin resistance. See, pancreas in our body secretes insulin and this pick up glucose from blood and use it for energy at various parts of the body. So, because of insulin resistance, more and more insulin is being secreted leading to hyperinsulinemia, and this acts on the ovary which becomes bulky and this secretes male pattern hormone, that is androgens, and this androgen act on the follicles and these follicles fail to mature or release eggs leading to an ovulation. Latest research has shown that in PCOD there is a chronic low grade inflammation all over in the body, and this can be due to physical inactivity, physical or mental stress, wrong diet or even lack of sleep. Any kind of stress in the body can lead to this. What are signs and symptoms of PCOD? Women may come to us with menstrual cycle irregularities with periods coming once in every 2, 3 or even 6 months. She may have scanty periods, delayed cycles or even heavy periods. She may come with history of weight gain, obesity, inability to reduce weight even after workups. There can be signs of hyperandrogenism like male pattern hair growth, acne, scalp hair loss, oily skin. There can be velvety pigmented skin at the nape of the neck, under breasts or thighs. She may even come up with infertility issues. Quality of sleep can be bad. There can be trouble falling asleep. There can be sleep apnea. She may snore a lot at night. She may come with mood changes, anxiety, depression and host of other problems can develop because of PCOD. Diagnosis. How do you diagnose polycystic ovarian disease? Worldwide there is a criteria known as Rotterdam's criteria, in which there are 3 components. If any 2 of these 3 components are present, she can be diagnosed as PCOD. Number 1 is clinically menstrual irregularity. I have already talked about. She can come with scanty periods, delayed cycles or heavy cycles. Number 2 is clinical or biochemical evidence of androgen axis. It can be clinical like in the form of hirsutism, acne or hair fall, or biochemical like serum testosterone is raised, there is raised DHEA, raised androstenedione, raised LH. LH to FSH ratio is more than 2:1. Third is USG appearance of polycystic ovarian disease. When you do an ultrasound scan, you can see that the ovaries are enlarged and the volume is almost more than 10 ml, and there are multiple follicles in it arranged in the periphery like a necklace pattern, and you can see more than 20 follicles in either of the ovaries. So what are the consequences of polycystic ovarian disease in future? Any woman who is not being treated for PCOD can develop in her later life type 2 diabetes mellitus, hypertension, dyslipidemia, coronary artery disease, metabolic syndrome, truncal obesity, or even fatty liver, and if left untreated can lead to even endometrial cancer. What is the treatment of PCOD? It should be a holistic approach. Lifestyle modification is very important. Weight reduction, even 5 to 10%, will improve androgen levels and will resume ovulation. Diet modification is very important. You should say no to junk food and avoid packaged processed food. Have healthy diet. Regular exercises, even 30 minutes a day, 5 days a week will help. Smoking cessation is very important. While treating, we need to categorize women with PCOD according to age group. Young woman, unmarried with irregular menses, we should first regularize her cycle with combined oral contraceptives. If a married woman comes who is not planning pregnancy, oral contraceptive pills will help, plus anti-androgens to reduce excess of hair. If a married woman comes who is planning pregnancy, then we should regularize her cycles, and ovulation induction drugs and fertility treatment will help. In PCOD patients who have completed family with obesity and menstrual irregularity, we need to regularize cycles in view of future health hazards. So we see that there is a complex interplay of genetic, hormonal, environmental, lifestyle factors in PCOS. Optimizing the reproductive outcome and tackling long-term health hazards are major challenges in treating PCOS women. Thank you.